Over the last 24 hours, we have identified 278 new cases of COVID-19 and completed about 5,500 tests. This puts our positivity rate at about 5.4%. We have identified 6 new cases of the variant of concern, bringing our total to 659. Our R value province-wide is 0.95. It is promising to have an RT value below 1, but we must all continue to do our part to move from the plateau we are seeing to a continued downwards trend. There are currently active alerts or outbreaks in 251 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 961 cases since January 11th. There are 254 people in hospital for COVID-19 treatment, including 36 in the ICU. Sadly, 6 new deaths were reported to Alberta Health in the last 24 hours. Each life lost reminds us about the serious nature of this virus and the need to protect one another from it.
Effective immediately, we're completing Step 2 and easing restrictions, which will mean a little bit more freedom for Albertans. First, we're expanding the capacity limit for the retail sector. All retail settings, including shopping malls, can increase their customers from 15% to 25% of fire code occupancy. And this change applies as well to individual stores as well as the common areas like hallways and food courts. Starting today, we're also expanding the Step 1 restrictions that apply to youth and including members of college and university athletic programs. Now, this means that lessons, practices, and physical conditioning are allowed for these programs with a maximum of 10 participants in total, including coaches, trainers, and participants. And remember, physical distancing has to be maintained between participants at all times. Everyone should be masked at all times, except during the actual training activity. As well, we're easing restrictions for child, youth, and adult performances so that folks, individuals, and groups can now rehearse and perform in preparation for filming or live streaming of a performance. And child and youth performances, and this includes dancing, it includes singing, theater, and playing wind instruments, must follow the same restrictions for youth sport, performance, and recreational activities in Step 1. This includes a maximum of 10 people, mandatory masking at all times, and 3-meter distancing between all participants. As well, no spectators or in-person audiences are allowed for any type of activity. Now, adult performers, whether solo or in groups, have a lot of the same restrictions. A maximum of 10 people, mandatory masking, 3-meter physical distancing between everyone, and no audiences. However, larger indoor film productions and other performances will be permitted, provided that there is no audience and they submit an approved plan that follows strict protocols. This includes regular testing as well for everyone included. And this will allow projects like filming movies, filming television shows to occur, provided that they implement proven steps to stop transmission. And finally, banquet halls, community halls, conference centers, and hotels. They can now open for all of the activities that are permitted under Steps 1 and Step 2. That includes hosting permitted performance activities, wedding ceremonies with up to 10 people, and funeral services with up to 20 people. Now, note that funeral receptions, wedding receptions, or trade shows are still not permitted in any venue. Today's announcement includes a lot of information, and remember that alberta.ca will have the details posted to help you understand what's been changed. I want to reassure all Albertans that this is a careful step, it's a cautious step, and we must and we will always be responsible.
We have been working with the lab for several months now, and because the testing process is quite complex, it's taken us time, and we're still not quite there to fully automate our reporting. So I will just note that the difference between yesterday's report, I believe it was 54 cases of variants yesterday, and today's report of 6 cases is actually a combined total of 60 over 48 hours. We are still seeing an average of about 20 to 30 a day, but unfortunately sometimes because that reporting is manual, sometimes we get a little bit more than 48 hours in a particular booking cycle, so that can unfortunately make it look like some days have a surge and the next day is quite low. So just a caution, again, until we are able to fully automate, sometimes we'll get a bit of variability on one day to the next. With respect to herd immunity, we do know that the variants are more infectious. And so we are looking right now at how we would incorporate vaccine coverage rates into our planning going forward with respect to how that informs what kinds of measures we need, but we don't yet have a firm number. You'll have heard, I'm sure, in the media, there are ballpark numbers, usually around sort of 60 to 70% is what's floated, but it is important that we validate those with, again, that information about the variant and that increased infectivity. And if we don't reach a herd immunity, again, what we'll need to do is continue to be monitoring for COVID-19 and its impact. The most important thing we need to mitigate, we need to prevent severe outcomes, hospitalization, ICU admissions, and death. And the vaccine right now is looking very good at being able to do that for individuals who receive it.